gynecologist in New York City, and I'm bringing to you all things health related for women. I am obviously driving today. I had to drive my husband out to a location 2 hours away from us, so I decided to, on the way back, to try and hit two birds with one stone, to try and get some chatting in and to see if I can get myself to the grocery store today. So we'll see how well this goes. Today I thought I'm still continuing the information about problems that have been coming up frequently in the office. And one major problem that comes up regularly, it's not just in the last couple of weeks, but it comes up very regularly, is people complaining that they went to the emergency room with a ruptured cyst. And of course they were told to follow up with their GYN doctor once they got home and were able to set something up. So ruptured cyst sounds really bad because it's something that's ruptured, and of course that sounds super painful and horrible, and it's a cyst, and we know cysts are not normal. They're horrible entities that can occur. So ruptured cyst is really bad, and of course the patient went to the emergency room because they were in tons of pain. So it's pretty significant. And of course by the time the patient comes into the office, she's usually not either no longer in pain or she's only in a little bit of discomfort. It's not as huge a deal as it was when she went to the emergency room. But when she went to the emergency room, she's usually doubled over in pain, and whenever I ask them what was done, it's usually the same thing that was done. It's usually that they took a pregnancy test, they did a bunch of vitals, they maybe did or did not do a sonogram. Sometimes they don't even do a sonogram, they tell them they have a ruptured cyst. Other times they do, and then they went home with a prescription for 800 milligrams of ibuprofen. So that's the usual scenario. So I explained to the patients that a ruptured cyst is normal, and their cyst just got to a slightly larger size than the average cyst does. So everyone who's not on birth control, either pills, shots, patch, ring, everyone, or the implant, everyone who's not on birth control, that hormonal birth control which stops you from ovulating, so everyone who is still ovulating is always going to have two cysts that develop every single month. They're normal. We call them functional cysts because they are cystic changes of the ovaries that allow the reproductive system to normally function. So the first cyst develops to produce an egg, and the egg is microscopic. Obviously we can't see the egg, it's microscopic, but the fluid that develops around it is what we see on an ultrasound. We call that a follicular cyst because it contains a follicle, which is what we call an egg. For the majority of women, that follicular cyst will get to about 18 to 22 millimeters. So about the size of maybe a super fat green pea to, what would be something like the size of like 2 green peas, so put together, maybe the size of a macadamia nut. So that's the normal size that it gets to be. Now the cyst can potentially get up to 5 centimeters. 5 centimeters is considered top normal. So if you think about a super fat green pea versus the size of a plum, that's a big difference. And it's all containing fluid. Now we say a ruptured cyst, but that cyst will always pop because that's how it releases the egg when you ovulate, and that's how you can get pregnant. If you don't ovulate, you can't get pregnant because there isn't any egg available for fertilization. menstrual cycle is due. So we call it mid-cycle cyst. The technical term for it, or the medical term for it, is called Mittelschmerz. It's a German term that means mid pain. So it's normal for the cyst to pop or to rupture to release the egg, and depending on how large that cyst got at the time that it popped will determine how much fluid is released in the pelvis. And fluid in the pelvis is always painful. Depending on how much is released, it will either not be noticed because it's such a small amount that it quickly gets absorbed into the tissues and you don't notice it, or it may be a large amount that it's sloshing around, it's causing a lot of inflammatory response, and it's very, very painful. So whenever anyone goes to the emergency room because they are doubled over in pain, they most likely got up to that 5 centimeter top normal size. And there's nothing to do but allow that fluid to get reabsorbed into the body. So Mittelschmerz is mid-cycle pain that's due to the release of the fluid when you ovulate, or when that follicular cyst ruptures or pops. And it's sometimes going to be accompanied with some light bleeding. The bleeding occurs because of the quick dip in the estrogen hormone that also coincides with ovulation. So most women, they'll get that cyst. It'll be about the size of a fat green pea, 18 to 22 millimeters. They don't notice any kind of pain with it because it's such a small amount. The dip isn't huge enough to destabilize the lining inside the uterus, so they don't have any bleeding. So most women, every single month when they ovulate, they have absolutely zero symptoms. It's okay. But it's also considered normal or okay to have a lot of symptoms. Some women have a small amount of symptoms every single month. So that's why they can tell you every single month they know when they ovulate. In fact, some women can isolate it to a side because it's such a small, it's enough to give them symptoms, but it's small enough where it's not a super big deal. So they'll feel a twinge or a small cramp on the side where the egg was released, or where the follicular cyst was popped or ruptured. That's totally normal, and it's with or without any kind of bleeding, spotting, or brown smudgy blood. Now, it's normal, on average, that Mittelschmerz or symptomatic ovulation will be 1 to 3 days with or without light bleeding, but it can occur for a full 7 days. I've had several patients over the years who've had pain and cramping and discomfort for a full 7 days, and some degree of light bleeding for a full 7 days. So that's totally considered within normal limits. We will usually do a sonogram or an ultrasound just to confirm there's nothing crazy going on. Every blue moon, someone will burst a small blood vessel when it pops, and then you watch them and you check their blood level, because if it does not clot and seal off soon enough, then they could lose quite a bit of blood. So that would be the only really concerning aspect of that. So this is part 1. I'm going to do a part 2 at the next presentation. So I hope that's been helpful information on ruptured cyst, or ruptured ovarian cyst, which is totally normal, but will always have to be evaluated if you're doubled over in pain and you end up going to the emergency